So thank you everybody for attending today. This is our second Vax Fax open office hours call. This is Kyla from Mountain Pacific Quality Health. And we have a guest speaker today, Dr. Malter, who will be talking to us about vaccine hesitancy. To start off, we will, just housekeeping wise, we will be sending out the slide set as well as the recording after the presentation, and also a one-page resource guide that will include a lot of the resources that we talk about today and some additional items that you can use to help with vaccine hesitancy. So first of all, we're going to start out with, if you remember from our last call, we did some leaving in action items, and we want to find out how well you guys did on those. So the first one is I have made available vaccine education materials in my practice for the following. So the three vaccines that we're focusing on here in this series: COVID-19, pneumococcal, and influenza. All right, let's go ahead and see how you guys did. So it looks like some folks implemented COVID-19 and influenza, but 0 for pneumococcal. So that's definitely something that we can work on providing additional resources on. Thank you for doing that. And then we've got one more question asking if you have tools available to engage patients in adult vaccinations. Just a yes or no on this one. Okay, I think we can look at the results. So a resounding yes. Woohoo. You guys are doing a good job. And you did all your homework. So today's discussion is going to focus on vaccine hesitancy, and we have with us Dr. Malter. He received his medical degree from Oregon Health Sciences University and did his clinical training at the University of Colorado. Before moving to Alaska, Dr. Malter had a faculty appointment at the University of Washington School of Public Health, where he taught public policy and conducted studies in health services research. A board-certified internist, he is the former Medicaid Medical Director for the state of Alaska and former president of the Alaska State Medical Association. He has also been with Mountain Pacific Quality Health since 2017 as our medical director. So welcome, Dr. Malter, and thank you for being with us today.
Thanks so much, Kyla, and thanks to all of you for participating. I'm certainly looking forward to this discussion because I think we're all learning about vaccine hesitancy, certainly more than we thought we would a couple of years ago. So I am most looking forward to actually the question and answer session at the end to hear the feedback from participants to kind of hear what's going on in their communities and kind of get their insights from the front lines. So I appreciate getting to do this presentation with you all today. Kyla gave me a gracious introduction. It's kind of embarrassing. That was so many years ago when I did most of that you almost forget about it until you get introduced to something like this. But I've certainly been I've enjoyed working at Mountain Pacific because, as most of you know, the group does important work trying to help improve kind of quality delivery throughout our 4-state region. So this is the most fun aspect of my day. I continue to do a little practice and hospital work, but this kind of larger view medical director job is my favorite part, and talking to folks like you. So with that said, I'll go ahead and try and go through my slides so we can get to questions and answers. I think we all have become acutely aware of this issue of vaccine hesitancy over the last 3 months in particular. This definition comes from the SAGE group, which is actually from the World Health Organization. It was a strategic advice group of experts on immunizations, and it came out 5 or 6 years ago. And it reminds us that though we're all talking about vaccine hesitancy now, this issue has really gone back for years or decades, dealing with all sorts of vaccines. Most of us weren't quite as attuned to it, although I think that our colleagues who do pediatrics or pediatricians have always been very aware of it and always spent a lot of their energy thinking about how to decrease vaccine hesitancy in their population. You can see the slide, you can come back to it. Essentially, vaccine hesitancy refers to the delay in acceptance or refusal of vaccination, despite the services being available. Next slide, please. The 4-state region that Mountain Pacific serves is interesting to look at. Some of you may know that some of the best states in the nation in terms of COVID-19 vaccine acceptance are in our group, Hawaii specifically. Hawaii's rate of vaccine acceptance of all folks is about 59%, which is very high. The average is 46 nationwide. And there are only 1 or 2 states higher than Hawaii nationwide that have better numbers. Alaska and Montana are kind of in the middle. Alaska's current rate of vaccine acceptance is 43%. Montana's is 42%, a little bit below the national average. Wyoming's is way down towards the bottom. Wyoming's rate of acceptance is 35%, which probably puts it in the bottom 3rd tier. And we will hopefully during this discussion kind of think about some reasons why that might be. Next slide. This vaccine hesitancy continuum graph comes from this article by McDonald, which again came from that World Health Organization group, the SAGE group. And what it's meant to show is that if you have the folks on the left who get every single vaccine they're supposed to, the day it comes out, and then those on the far, far right who are really not willing to accept any vaccines, that there's this hesitancy continuum in the middle, which kind of varies from folks who are pretty close to the left, and then varies all the way down to folks who are pretty darn close to the right edge. So this group of hesitant folks is a heterogeneous population. And what we want to talk about today is various methods by which maybe we can move folks who are in this middle triangle. We can move them to the left so they're more open-minded to accepting our advice, especially about coronavirus right now. Next slide, please. Again, from this model of the World Health Organization working group, this 3 C's of vaccine hesitancy is pretty well accepted now as the kind of most current way of thinking about hesitancy. It talks about complacency, and I think most of us understand that, a lot of folks, during flu season, for example, seem to telegraph to us that, well, they're not that concerned if they get influenza. They're complacent, and they seem to think that the risk of influenza perhaps is lower than those of us who are healthcare providers and see bad cases do. So we call them complacent. Then there's an issue of confidence, confidence in the efficacy of the vaccine, but also confidence that the vaccine doesn't have side effects. Again, right now we're all acutely aware of kind of the lack of confidence for certain folks in the COVID vaccine, and we understand that. And we'd have to think about how to increase folks' confidence if we want to decrease hesitancy. And then lastly, convenience. And I think most of us become experts in convenience in the last 3 or 4 months. Who would have thought that most of our communities would be setting up, mass vaccine centers downtown, to run this, to make it more convenient for some folks to do it. But also, we've also become aware that maybe despite the fact that Some socioeconomic groups can find it pretty easy to go to a mass vaccine center on a Monday through Friday and take off a day of work, or maybe they're retired. We've also kind of become more aware of the fact that maybe folks who are, working, in certain jobs find it very difficult to leave their workplace to go get vaccinated downtown. And it's really much less convenient for them than some of us would realize. Next slide, please. Kyla and Mountain Pacific will distribute, or will have at the end of this presentation, a resource sheet. And I actually, they were put together by Kyla and Stevie Tsai, another pharmacist, and they really are quite good resources. I went through them, and I think for any of you who want more information, it is an excellent first step, and it can get you almost anything you need. One of the resources is talking about vaccines from the Immunization Action Coalition. And as you can imagine, it's a group of medical professionals, and they discuss immunization concerns. A lot of that, as I recall, was from a few years gone by, perhaps, where they're oriented towards talking about more generic concerns of pediatric patients' parents, for example. Then the Institute for Vaccine Safety, another resource that you can look at. But I think there were 1 to 2 dozen total, and I thought they were all very good. There were resources from the CDC, you can see, and all sorts of folks, as well as the SAGE group's articles that I referred to above. Next slide, please. So as you look through those resources, you kind of come away realizing that perhaps the most effective approach to moving somebody from being very hesitant about vaccines towards being more accepting is using these motivational interviewing techniques that I think most of us are somewhat familiar with. These are techniques where you go through certain steps, and you start, for example, by presuming that somebody's open-minded to getting vaccinated. So perhaps they come into your clinic or wherever you're working, your system, and the base assumption is that they are going to get vaccinated. So that when you're talking to them, you say, okay, we're going to do this vaccine today. And you just start with that. If the folks then say, they have reservations about it, or they're hesitant, then you use the motivational interviewing techniques to evoke some of their concerns, why they're concerned. You want to kind of respectfully listen to them, of course. You want to provide the best facts. Even if they are concentrated on things that are perhaps not factual, you don't really want to argue with your folks, with your patients. You want to instead provide them with the information that we all are aware of that supports the use of these vaccines, and focus on those facts. And then you ask them if, now that they have this greater body of information, whether they're more open-minded or now they're willing to get vaccinated. So that's a motivational interviewing approach that could be used for vaccine hesitancy. And like all MI, at the end, you want to give them positive reinforcement for owning the decision that they make, and you don't want to be disrespectful. Next slide, please.
So before we do this slide, we're going to do another polling question, and it's related to the stuff that we're going to present from a recent Alaska Health and Human Services survey. But we want to know, what do you think are the top reasons patients are hesitant to get a COVID-19 vaccine? Okay, I think we can show the results on this one and see. The wait and see wins. How many of us have heard that fairly frequently? So Dr. Malter, I'll let you talk about the survey that the Department of Health and Human Services did. in Alaska?
Will do, although Kyla, I did not see the results. And I'm just curious, can you go over the results for us? They didn't show up on your screen.
Oh,
No, I'm sorry, the results of your little mini survey right there.
oh, they didn't?
They didn't, I didn't see them, maybe other
Oh,
folks
did everybody else see them?
I could see them. I saw them.
I didn't see them. Okay, there they are. I'm sorry, maybe I was.
Oh, okay, sorry. Yeah, so misconceptions and the wait and see were the highest percentage. Surprisingly, side effects was a little bit lower, which I'm kind of surprised about. It seems to be another pretty common reason.
Okay, thanks. So now, so I wanted to pull up this EPI bulletin from the state of Alaska. I'm sure most of your states' sections of public health do similar types of surveys. This came out last week, which got me kind of excited since I was doing this presentation. And it was based on a survey that was done a couple of months ago. And I think it makes a few points. One point is that things change quickly in coronavirus hesitancy, coronavirus issues to start with. So even results from a couple of months ago may be, I don't want to say outdated, but may not be quite as accurate or valid now 2 months later. But go ahead, Kylan, go ahead and show the first slide, perhaps. So the survey was of 12 or 1,300 folks who were adults and had cell phones. It was not the most rigorous survey methodology, but it was just kind of a quick and dirty survey. About 50% of the folks who were contacted had been received at least one vaccine, and about half had not. Of the half that had not received them, about a quarter said they were open-minded doing it. They just hadn't gotten into it yet. A quarter were that hardcore group on the far right of that first slide who said they were just not going to take it regardless. And about half of the folks who had not been vaccinated, about half of them said that they were hesitant because they had concerns, but they had not made a final decision. And then when they looked at kind of a subset who were hesitant but very open to learning about more information, they looked at why they had been hesitant. And coming back to that complacency and confidence issues, safety and side effects was a high one. COVID not serious, that comes back to complacency. Rushed wait and see perhaps corresponds to the results that Kyla just got a couple of minutes ago. And I think most of us have heard these. Those of us who are in the field doing these have heard a smattering of these from our patients who we try and convince to move on the hesitancy scale. Next slide, please. This was just another question that they put to the group. I don't think it's critical, but it does remind us that there's kind of a lot of emotions about this, and a lot of individual responsibility, helping protect others. Those are all, I don't want to say, I mean, they're important ideas. They're hard to quantitate, and they're ideas that probably are sometimes relatively deeply held. So a lot of kind of issues that are not quite as clearly scientific in a sense as we think about with some other vaccines, are just a little more social, perhaps, than at least the way I'm used to thinking about treating patients. Next slide. And this just comes back to this data that most of us have seen, that people get their information from friends, and then healthcare providers are way up there in terms of who folks trust to get information from. Faith leaders are down towards the bottom. Some of these have to do with Alaska-specific leadership. Next slide. Okay, so I put those slides in about Alaska just to kind of remind us that there's a lot of that type of data out there, and I think it almost changes on a month-to-month basis depending on what's going on in the community. So it's not that you hang your hat on it. It's just that it gives you some ideas of things to talk about with patients as you're trying to motivate them to become more accepting. One of the Alaska slides that didn't make it in talked about why you do it. And of course, it talked about a lot of the responses were to protect your family members and to protect your friends and to make it more feasible to get back to normal through this pandemic. And indeed, that's kind of concordant with what we've seen out of the CDC in the last 2 weeks, where they're softly opening up the notion that if you've been fully vaccinated, then you can be a lot more liberal in terms of going without your mask out in the community or even on even some indoor small events. So hopefully those new messages from the CDC will kind of mesh with the answers to the survey in Alaska, for example, and it'll encourage people to be more open to getting vaccinated. So with that, I'm looking forward to the discussion. I suspect that some of you are just as knowledgeable and more knowledgeable than me on this issue. So I'm certainly looking forward to questions and also getting perspectives from all 4 of our states. Kyla, maybe I'll let you take over the question and answer part to start with.
Yep. If Maynette, if you could open up all the lines, you can feel free to, you'll be on unmuted for this portion, and then also feel free to type questions or comments in the chat. And I guess just to start us off, I would like to get some feedback from you guys on kind of what things you've heard from patients and how you've maybe changed their mind or seen them kind of move on that continuum that Dr. Malter was talking about.
Everyone has been promoted to panelists, so they just need to unmute themselves.
Okay, perfect. Thank you.
Kyla, while we wait for others to chime in, do you have any, I know that you also provide vaccinations, so can you share any experiences you've had around vaccine hesitancy and how you've overcame it?
Yeah, probably the most notable one is my brother, who was not wanting to get his vaccine, but as everything kind of progressed up here in Alaska, he works up on the North Slope. He saw others that kind of had a surge in cases. And then with also kind of me bugging him about it, I guess, you know, continually, he eventually did get his vaccine. So that was kind of more of a personal story, I guess, but also kind of leads to that fact that people do get a lot of their information from family and friends, whether they're healthcare professional or not.
We also have another one coming in through the chat. It says, do you have any creative recommendations for helping to educate more rural communities and that community chatter on myths, such as like working with religious entities or grocery store clerks, etc.?
I have seen the Department of Health does have at least one public service announcement where they were addressing the kind of like the religious groups or the church kind of communities as far as encouraging them to get vaccinated so that they could congregate again. I don't know, Alex, if you've seen anything like that.
Well, I think it's a good point. I think that religious leaders are often respected, understandably. And I think that it has occasionally been difficult to persuade some of those folks to make strong messages. And unfortunately, I think it maybe is a reflection of how, how divisive this issue has become in certain communities. So I do think it's tough, but I think that if public health leaders can go out and could persuade or maybe invite in some of the prominent, church leaders or other leaders in communities and encourage them to be more open-minded to supporting, a progressive, a vaccination approach, it would be beneficial. But I think it's hard to do, and I don't think there's any great data to show that there's one way that that's going to work. So I think it's a good point, but I think it's still a tough nut to crack.
Great question. Thanks for asking that.
I'll share an anecdote just for a moment. I think that this stuff is very hard, even when you're trying your best to use motivational interviewing techniques, for example, and to try to be dispassionate. I think most of us who, are invested in this issue kind of become passionate about it, and we get kind of emotionally set on our own position. So even though I strive to kind of remain as neutral as possible and not be disrespectful to the folks I see in clinic, I think even, and I practiced for 35 years, and I can still get sucked into kind of getting a little frustrated with folks when I can't persuade them to do it. So it kind of shows that not only that this issue is so, it evokes so many emotions, even from those of us who are trying to be a little bit dispassionate, that it is just very, very tough to have these kind of even-handed discussions. And I do think if you can stick to motivational interviewing or be cognizant of it, that maybe makes it 5% easier to not get sucked in to getting frustrated with folks who maybe have, they think about things differently than most of us do. I think there was a question that I interrupted.
No, that was really great, Dr. Malter. Thank you for sharing that. There was actually just a comment made that it seems like the root cause of a lot of this is trust. So I definitely think that that is a common thing. Who do we trust? Where do we get that information from? That really plays into vaccine acceptance. One thing that Mountain Pacific has been doing, and maybe Tony King can allude to it more, but trying to get out there and do some of that myth busting and have an open office hours and things like that. We have worked with our partners with AARP to have town halls where we've allowed members to call in, ask any questions they have. And we've been doing a lot of that work, trying to, like you said, get into that community chatter and really present accurate information through those.
There is some, if you read some recent literature, kind of almost op-ed pieces, there's some thoughts that we maybe are going to start moving away from these mass vaccine events back towards smaller, kind of office-based or pharmacy-based vaccinations. And that maybe by moving patients back into the pharmacy or into their medical clinic, maybe they'll be more trusting of their physicians or their nurse practitioners, or maybe they'll be more trusting of their pharmacists at their small retail clinic than, in these mass vaccine centers. So maybe as we move back kind of towards retail-based, in a sense, using the term generically, kind of small clinic-based advice, maybe there's a chance that we'll be able to impact some of these folks the same way we have for other vaccines. But I think most of us are aware that even for things like influenza, which are offered at physicians' offices and pharmacies, that there's still only, I want to say, a 50-ish% acceptance rate year to year, kind of depending on which region you're in. Don't quote me on that, but that's my general gestalt. And maybe even a little bit lower for pneumococcal vaccinations. So I just think that they're hard nuts to crack, and it comes back to that complacency issue and convenience and incompetence.
And I'd like to add in, if I could, this is Tony King, Director of Pharmacy for Mountain Pacific, and I appreciate the opportunity. And I would agree, Mountain Pacific, we're doing what we can. We're doing the AARP town halls. We're getting on the radio. We're working within our communities the best we can to try and, help curb some of this vaccine hesitancy. Having done clinics in and around the state and working with some of the chain pharmacies as well as retail pharmacies, I can tell you that, they were prepared to do a lot more than they've done, and the appointment system is drying up pretty quick, and now they're looking at ways to get back out onto the road and do some of these offsite clinics as well. They're working it into their workflows for the pharmacy side, trying to do whatever they can. So we just need to partner with them and help them, and then hopefully we can boost that number up.
Thank you, Tony, for sharing.
I guess I've got a question for the group. My hunch is there are folks here from Montana, Wyoming, Hawaii. Out of curiosity, folks in those regions, what are you hearing and seeing in terms of on the ground in your communities where you're trying to persuade people to get vaccinated? Are you seeing any patterns or any trends different than those I described?
That's such a great question. I'd love to hear if there is anything else you're hearing out there. I know I do see definitely representation from all those different areas. So if anyone's willing to share, we'd love to hear what you're experiencing.
Hi, everybody. This is Eileen Ford, and I'm in Casper, Wyoming, and I'm not a clinician, just kind of a layperson. I work with Mountain Pacific in coalition work, but I'm just like, I just had this conversation with a friend this last weekend. She's a nurse, a critical care nurse. She's been in the hospital through all of this. She's been in a nurse for 25 years. And when she told me that she was not going to get the vaccine, I'm sure the look on my face was just pure shock. And she went on a tirade about how it wasn't, it was rushed to testing and it's not proven, and on and on and on. And to me, those are some of the most dangerous naysayers because they're in the healthcare profession. And she's got a pretty wide social circle and she's a really vocal person. And I just really wonder, and I've heard it many times, that in healthcare settings, the acceptance among healthcare workers is kind of low. And I feel like that's a really important place to start because that's a trusted resource. And if you've got nurses and medical people running around saying they're not going to do it because they don't trust it, it's really hard to overcome that.
Yeah, thank you, Eileen, for sharing. That's a really good point. And that is something that we have in our resources guide. We did have a section where we talked about healthcare hesitancy specifically, but I completely agree that that's somewhere where we could move the needle if we targeted that group a little bit more intensely. And I think Wyoming has one of the lowest acceptance rates. I don't know what the rates are right now, but I know that some of my colleagues in Wyoming had said that.
Great feedback, Kyla and everyone. And if we don't have any other questions, then we can move on to our next slide. We have a few more things to talk about.
We're going to do what we did last time with our leaving in action and give you guys a couple homework assignments. So back to the motivational interviewing. If you could go back to your practice site or to your community and have some conversations about motivational interviewing, even if it's just, hey, do you know what this is? Have you used it with your patients? Have you seen it be effective? Then that would be really a good intervention that you could do in the next 2 weeks before our next session. And then also offer or recommend vaccines to 2 patients. And it doesn't just have to be COVID, because we are focusing also on pneumococcal. That one is probably one of our biggest drivers right now, just because the rates are so low. They're the lowest of all 3 of those vaccines. And there are a lot of patients that are eligible for a pneumococcal vaccine that may not even know it, including patients that may have certain chronic conditions, chronic lung conditions, patients with diabetes. We usually think the 65 and older population, but there's a lot of other folks who also qualify for that vaccine and can get a lot of benefit from it. And then our next session will be in 2 weeks. We're going to talk about vaccine efficacy. So if you're registered for the series, or if you haven't yet, if you just, well, I guess if you register, I think you register for the whole series. But if you want to share it with friends and colleagues, anybody else that might be interested in getting involved, we will see you then. And we do have a a survey that will come up after the presentation. And we would be much appreciative if you would fill that out, evaluating our presentation today so that we can make it most valuable to you and your time.
Fantastic. Thanks, Kyla. Thanks, everybody, for listening in.
Have a good day,
Thanks, everyone.
everybody.
Bye. Bye.
Thank you.